Performing a breast self-examination. Women in Singapore are more likely than men to develop breast cancer. 1 in 14 women before they reach age 75 is estimated to be diagnosed with breast cancer. If you want to keep an eye out for breast abnormalities in your lifetime, please do a visual examination of your breasts in front of a mirror holding your arms apart in a neutral position. You may notice any of the following changes in your breast: dimpling or puckering of the skin on the pole by the pole, persistent rash on the pole, retraction of the nipple, bleeding or unusual discharge from the skin around the pole, etc. You should raise your arm above all behind your head, place your hands on your hips, and tighten your chest muscles as you feel redness, soreness of the breasts. Highlight Sabines of the surface of your press. You can feel for changes in your breast, underarm and collarbone areas more accurately by using these positions to examine changes in the shape and size of your breasts, and for dimpling or puckering on the breast skin on the pole. It's easier to feel for lumps when you're lying down, since your breast tissue is spread evenly across your body. What you should be on the lookout for is a swelling or thickening in the breast or underarm area. Many large lumps can be located by lying down. When you are lying down, place a towel or pillow underneath the right shoulder. This will allow you to examine your breasts more easily. Using your right hand, place the pads of your 3 fingers under your head and extend your right elbow outward. By using 3 different levels of pressure, you can feel for all the breast tissue from the skin by applying pressure in a circular motion. To examine your breast systematically, move your hand clockwise or anti-clockwise, passing over the nipple first, then the tissues closest to the muscles and ribs, in a circular motion with 3 different pressure levels. Check for lumps in your underarms and then move up your breast, making overlapping small circular motions to check for lumps if you're in the wrong area. Choke gently above the collarbone, while moving in a circular motion. Perform similar steps on your left breast. How often should you do a breast self-exam? The best time to do a breast self-exam is about a week after you begin your period. If you are no longer pregnant, breastfeeding, or have breastfed, performing the exam on the same day each month is more effective. However, it is important to be aware that breast self-examination can be complementary to breast cancer screening, not a replacement for it. However, for your own safety, we recommend you consult a doctor as soon as possible if you find any lumps or changes in your breasts.